Thank you, Dania. How do you summarize the work that has been done in the last 2 years that we're celebrating, 2020 and 2021? It's difficult. I've been thinking about this for months now. What can you say to a team that has held their head high, led with dignity and grace, shown up each and every day, even though the burden that they were carrying was so heavy? It's been a difficult year, to say the least. I think I've yet to meet a nurse who hasn't said that this last year is the toughest year they've ever experienced in their career. I've been in healthcare for 27 years, and nothing holds a candle to what we've experienced in this last year. How we support each other, how we foster each other, how we celebrate each other when we're brave and courageous enough to seek the help that we need from our mental health care professionals, how we normalize talking about our mental health with our friends and our family and our supporters is incredibly important every day, but now more than ever. We've struggled as a healthcare community in general. This has been difficult on all of us. We have to make sure that we're taking care of ourselves and taking care of each other. Seeking help with mental health isn't a weakness, it's a strength. When we see our friends and family seeking that help, tell them you're proud of them, that they're doing a great job for taking care of themselves and taking care of their friends and their family. As we reflect on everything that we've been through, it's important that we don't lose sight of the great things that have been done over the last 2 years. Incredible work has been accomplished, and when we look back, we just celebrated our 4th magnet designation, 16 years we've had. We've got another 4 coming. It'll be 20 by the end of this designation. There's a lot of really hard work with high quality, excellent care and work that has gone into that designation and that award. It's not given lightly. Many have heard me say time and time again, this is the best nursing team in the nation. And what I would say to them now is this is the best nursing team globally, hands down. I couldn't be more proud to come and work with this team and be a small part of what is being done at Billings Clinic. This group never fails to inspire me, to make me proud, to make me want to show up every day and do my very best job to support them so that they can do the best work that they do. Our patients and our families and the feedback that we receive from them are the best compliment and the best evidence that we could ever receive for the care that's given by our healthcare team members. I know that our community and our families are safe in receiving the best quality care here at Billings Clinic, and some of the honorees you're about to see today are a huge part of that. There's a very long list of folks that we could recognize today. The top choices that you're seeing today, it was very difficult for us to narrow that down. As they come up, they have done over this last 2 years, how hard they fight to lead their teams and do the best that they can for their patients and their family members. And know that when they're taking care of our patients and our family members, they're taking care of them as if they're one of their very own loved ones. They're in the best of hands. I say to our award winners today, thank you from the very bottom of my heart. There are enough words for everything that you do. Thank you.
Scott, would you like to say a few words? And then we'll get the show on the road.
Thank you, Lori. That was really heartfelt. And Ellen, thank you as well. Unfortunately, we don't have the doves, but it was a really nice blessing. I'm Scott Elner. I'm the CEO at Billings Clinic, and I am proud every single day to be part of an amazing organization that's Billings Clinic. What you're seeing here with our award recipients, our 2021, our 2020 award recipients, and our nurses, our CNAs, is Montana strong. That's who we are. This is our home. and we are building Montana strong. That's what Billings Clinic is about, and we are creating a culture where you have the care, compassion, and the amazing clinical acumen to take care of most anything that comes to Billings Clinic. And we've seen that. During the height of the surge, we had over 100 COVID patients in our facility. We had to build out 60 rooms in order to make more space and capacity available to continue to take on the surge of incredibly sick patients. And our nurses stepped up to the challenge every single moment. Never did we shut down. We were always there to be here for our community, for Montana, for the people we serve. And it just fills my heart to look at all the recipients and the people that make up their teams, the CNAs that worked incredibly hard moving patients, getting them out of bed, our nurses having to don and doff many, many times the protective equipment throughout the hours spent caring for patients at the bedside, in the clinics, in the VTU, the viral triage unit. You are all amazing, and we are truly blessed to have you as healthcare providers. This organization, Billings Clinic, is incredibly proud. The magnet designation that we just received is only recognized by, 90 hospitals or health systems globally, worldwide. Nursing recognition, nursing excellence. We're in the top tier globally for nursing care. And so it's really a testament to the amazing hard work, diligence, through the trying times that we're here today, and we can look back and say, we did this. Billings Clinic got us through one of the most difficult, challenging times that we'll ever see in this century. So thank you to our nurses, our CNAs. Thank you. Thank you to the physicians who are part of the award ceremony today. You are all part of a legacy that we will remember for a long time because of how much you fought through such a difficult challenge and the care you provided. And Billings Clinic is really proud to have you. Thank you.
All right. Thank you everybody again for coming. So just a little bit of housekeeping. So we're going to start with 2020 award winners. And so when you come up, our awards are on this side. Lori will hand you your award and your recognition certificate and the write-up that was written about you. If you could pause in the front with Lori giving you your statue, then we'll have our photographer take a picture at the same time. Okay? All right. No more holding back, right? So 2020, let's start this. Billings Clinic 2020 Friends of Nursing Outstanding Nurse Award. Number 1 goes to Jonathan Baker. He's an RN from the inpatient cancer care, and he was nominated by Austin Barassa and Carla Hunt. So one thing that Austin said about Jonathan Baker has truly been a part of my Billings Clinic journey since I started 7 years ago on the inpatient cancer care unit. As a new CNA, I quickly learned that Johnny was a safe person. Not necessarily just in his patient care, but in the way he treated others. I knew I could bring my questions to Johnny, and when it was time for me to graduate nursing school, I began thinking about who I would hope would precept me for our team. One person kept coming to mind. You guessed it, Johnny. I asked Johnny and the unit leadership if this was possible, and both agreed. As many of you know, being a new graduate nurse is terrifying sometimes. Johnny possesses another human skill that only helped me in that fear. He is calm. I spent many weeks with Johnny at my side, teaching me how to be a nurse, and not just a nurse, but an oncology nurse. He stepped up to the plate more than ever. As ICC took on COVID, double occupancy, and cardiac overflow, Johnny never once complained. He would bring forth questions and concerns appropriately but remain supportive of his team members. When other teams in the hospital reached out for help, ICC leadership often went to Johnny. He never once complained about being with other teams and would often stay late when asked. When asked, Johnny suits up and takes one for the team. Fitting since we're in the baseball stadium. Some things that come to mind: he is kind, he is caring, he is compassionate. He remains calm even on the busiest of days. Austin says, "Johnny, you are an outstanding nurse, and more than deserve this Outstanding Nurse Award. Not only is Johnny an outstanding nurse, but he is also an outstanding human being. Thank you, Johnny, for all you do for ICC and the Billings Clinic." Our next Friends of Nursing Outstanding Nurse Award, Humphrey, an RN from the Cardiac Surgery Center. She was nominated by Sarah Turner. She always goes the extra mile. She stays late, helping everyone almost every shift. She takes everything on without a complaint and does everything the best that she can. She is the person that everyone knows will get things done. She triple checks start charts, and she makes sure every person is getting the best care possible. She trains every CVU nurse on what we do. She helps new nurses learn about what we do. She knows our processes inside and out, and she always knows the whole picture. She supports the process improvement for the unit and the organization. She has innovative ideas that made an impact to the patient care experience, and above all, she advocates changes in patient care and demonstrates excellent PSC. Jamie is kind, courteous, courageous, thoughtful, and helpful. Patients absolutely appreciate her and her hard work. Thank you, Jamie. Our next Friends of Nursing Award goes to Psych Youth. So Jenna leads by example. She places the needs of her patients and coworkers above her own. She takes it upon herself to improve camaraderie among the OR staff. During the work, Jenna is looked upon as a resource for everyone on the team. While working as a surgical tech first, oops, I think that's not inpatient psych youth. Oops. That would be OR. Typo, first one, check. When talking with Jenna, there is never a conversation that doesn't somehow spiral back to patient care. She has a passion for patients. That is her why of being an RN. She loves taking care of patients. Jenna has mentored many new team members to the OR. She is patient, calm, and skilled in her role. She has also taken in RN students for their internship. The students follow her for over 140 hours, and her dedication has directly led to hiring some of them permanently after graduation. She is actively engaged in the department. She has been a member of the Scheduling Guidelines Committee, and she went to an AORN conference and was so excited to share what she learned when she came back. She is caring and supportive. You know you are in good hands when Jenna is your nurse. Thank you, Jenna. She's from the OR. Oh, they told me hockey, like the sport. Fitting since we're in the stadium. Thank you. Our next Friends of Nursing Outstanding Nurse Award goes to Scott Young, the Orthopedic and Neurosciences Unit. Scott is very involved in leadership of the unit. His leadership really does show when he isn't a charge nurse for his shift. He appears to always be less stressed than anyone else in the position. And he's also involved with ONU committee as the lead facilitator to help find reasonable solutions to our unit's current issues. Scott is a great person to have on any recruitment team. He would be a great person to conduct interviews with future possible employees. He makes people feel comfortable and easy to work with. As the leader of the ONU committee, he shows he wants to improve the quality, safety, and service of our unit. He has shown his caring by helping other nurses, CNAs, and unit clerks. Scott cares about everyone, or else I do not think he would be as involved as he is. Scott is very knowledgeable and likes to share that knowledge with others. He is also involved in nurse associations and organizations outside of Billings Clinic. He always seems to want to learn more and better improve his skills as a charge nurses, and could see himself moving up into a manager role someday. People describe Scott as a very knowledgeable, easy to work with, Works smooth under pressure, leader, able to communicate in ways people understand regardless of the person's education. Thank you, Scott. For Billings Clinic 2020 Outstanding Nursing Support Staff Award goes to Ashley Evenson, a patient care tech from the emergency department. She was nominated by Brad Von Bergen. So Brad nominated Ashley Evenson for the Nursing Support Award. Ashley started with the department back in March of 2019. She's a patient care tech too and exemplifies all of our organizational values. She has also been awarded the B and Zach Award for the kind and compassionate care she provided to a victim of abuse. She went above and beyond, keeping him safe and comforted. She spent her own money to buy him a teddy bear. Her smile and laugh are infectious. Ashley lifts up her coworkers and is always lending a hand. Ashley is loved by her patients and team. Here are a few of the comments from your coworkers. You are an amazing coworker in person. You exemplify. You're kind and compassionate. And Ashley gets complimented by her patients and has been recognized for going above and beyond. We are fortunate to have a team. Ashley comes to work wanting to make a difference, and does. Thank you, Ashley. Outstanding Nursing Support Staff Award, Megan Pierce. She's a medical assistant from the Same Day Care. Oh, she's not here. Hailey Morrison. She's a CNA from CVU, Cardiovascular Unit. She was nominated by Carla. So Hailey noticed that patient care was being interrupted by healthcare workers and guests. Even still enter the room after she said, "Patient care, please wait." She was concerned about patient dignity and privacy. Instead of just complaining about it or ignoring it, she thought of a potential solution. She created signs that are attached to the patient door during cares. It states, "Stop, patient care for 15 minutes, please wait." She spoke about it at Partnership Council and also had it included in huddles. When providers rounded, she would educate them on the purpose of the signs too. This small change has had a massive impact on our patient care. People see the bright yellow sign and will before entering. Patients are provided sensitive cares without the worry of someone walking in unannounced. I even had a nurse from another floor ask how we could get those signs for their unit. I happily shared them so that Hailey's innovative idea and process improvement will help other floors and patients. During COVID, other units were taking COVID CVU patients, and she helped to develop a reference for the other units so they could provide the highest quality of care for their patients. She takes it upon herself to learn new systems and is noted as a resource for the staff on the unit. They all say, "Go to Hailey, she knows what everything is." She's very helpful. She makes it clear what we're focusing on. She comes very well prepared to precept and provides as much information as she can in time while being very sweet. Thank you, Hailey. Taylor Becker. This one is a mental health worker from inpatient. Sorry. So Taylor has been actively involved in creating ways to provide quality care to the patients while working with team members to create a unit library for patients and improving the quality of care delivered by facilitating a mental health worker work group who developed qualifications to enhance an entry-level position and transition it from a mental health worker to a psychiatric technician. She was one of the team members who was integral in moving this process forward. She is a star when it comes to identifying areas of opportunity, and she's mentioned by patients and staff as being friendly, helpful, caring, and kind. She maintains a positive attitude and always has a smile to brighten anyone's day. Patient care is her passion. She has made improvement in patient care through the development of education. She's a preceptor and a mentor for psychiatric technicians, and she's currently working on finishing up her BSN and will be joining our team soon in her new role as an RN. She has worked with other team members in bringing evidence-based practice initiatives to our units, enhancing the care we provide. She is 100%. She goes above and beyond, investing for the experience our patients have while receiving care. She's an amazing team member that everyone enjoys working with. Thank you very much. And now. So this year's last year's 2020 Nurse Nominated Outstanding Physician Award goes to Dr. Justin Botsford Miller. He's a physician from the Gynonc group and was nominated by Kristen Klebe. Justin values nursing input in patient care planning. In the past, his history of nurse navigation was not included in treatment planning alongside of the MD. He realized that the patients are truly at benefit when the nurse is involved. Of course, he does his part in decision and treatment making, but teamed with the nurse, they are able to provide whole person care and ensure all ancillary services are involved and appropriate referrals are made. He understands the value of nursing education to patients and improved outcomes with nursing input from the ERAS program and improved surgical outcomes. He takes his time to round in the infusion center. He takes his time to know the nurses for the care they provide to his patients. This is not only appreciated, but has improved patient care. Nurses know they have an ally to reach out to when something isn't quite right. He participates in Yellow Belt projects with the nurses. He is data-driven and has partnered with quality to ensure that metrics measured are for a nurse ERAS program will show a real benefit for our patients. He has been very supportive of Kristen obtaining her master's degree and supports anyone in the office who would like to take the opportunity to further their education. Thank you, Justin, for all that you do for nursing. The 2020 Friends of Nursing Outstanding Leader Award, Christy Baxter. Christy is the Director of Critical Care Services and was nominated by Jessica Johnson, Sarah Hockelek, and Megan Versman. Actively working as an advocate for nurses and to pursue quality and safety in patient care, Christy is on the Hand Hygiene Committee, Nursing Senate, and is on the Billings Clinic Foundation Board of Directors. She is a valuable member of CVU as well as the entire organization and is proactive in ensuring open communication between the nursing staff and other departments in order to attain high quality patient care and safety. She reaches out to other departments and specialties with questions and concerns from both service line and informal settings. Safety and service, Christy initiated the failure to rescue process, which reviews cases involving PRs and ICU transfers that occur on the CV. Resulted in process changes, staff education, and debriefing, and helps to ensure timely intervention in order to improve patient outcomes in those critical situations. Christy is devoted to the nursing profession, her nursing staff, and especially to the patients and families that we care for. She has over 30 years of experience as an RN. With much of that devoted to critical care in the ICU, she is extremely knowledgeable and an excellent resource to her staff. On a regular basis, she is ready and willing to assist and offer her experience and expertise. Knowing that Christy is there for support, RNs enter her office daily and share their concerns with about patients' conditions. She immediately goes and helps the nurses to assess the patient, then assists in contacting the provider to relay the concerns. One of the forces of magnetism in nursing is high-quality nursing leadership in itself. Christy is an exceptional nurse manager and has helped, now she's a director, and has helped to maintain the unique culture that exists among staff on CVU. She is respectful of the ideas, opinions, and feelings of others, listening attentively and offering feedback with sensitivity and kindness. She actively works with the Partnership Council, receiving and reviewing suggestions to improve processes and potentially make changes which save time and resources. She has already pursued her master's degree, this was written last year, and has received an academic award for a paper she wrote on the topic of heart failure. Sharing new insights and knowledge gained from her studies with the staff on CVU, as well as the hospital at large, she inspires a desire to learn and further the nursing profession. Thank you, Christy. Friends of Nursing Outstanding Leader Award, Shelly Baker. Shelly is the clinical coordinator for same-day care. She was nominated by Martina Drum. Shelly Baker is the clinical coordinator at same-day care and express care and took the initiative at the very early stages of this COVID pandemic and delivered a proposal to open a separate unit at Billings Clinic to facilitate evaluations and testing of potential COVID-19 cases in order to protect the patients and staff alike from potential exposure. She worked tirelessly to bring VTU up to a fully operational status, providing processes for evaluation, staffing, navigating patients appropriately. I am in awe of her initiative, motivation, and professionalism, and relentless pursuit of what is best practice for these turbulent and uncertain times. She presents everything I admire in nurses as advocates for what is right in the world. It is my honor to nominate Shelly Baker for outstanding contribution to the nursing profession. Thank you, Shelly. Friends of Nursing Outstanding Leader Award, Callie Bermandel. Callie is the nurse manager of Same Day Care and VTU. These are both VTU much, so. 2020 was an exceptionally challenging year for everyone in healthcare. Despite very little knowledge about a virus that was wreaking havoc across the world, many of our own team ran towards the chaos to serve our patients and community. The team in the VTU was one of those who courageously ran towards the unknown. The leader of this team is Callie Vermandel. Callie led the team with empathy, courage, and resilience. During the height of the pandemic, she worked many long hours for weeks on end to help support the team and to meet the needs of our community. Callie truly embodies what it means to put service above self. The VTU was once thought as a temporary measure during the pandemic. However, by fall, the VTU had outgrown its original location and needed additional space. Callie worked collaboratively with multiple stakeholders, and in 24 hours, she led a team to begin nurse visits in the psychiatric gymnasium. This 100 patients per day for several weeks. Throughout the uncertainty, Callie held the safety of the team as a top priority. She ensured the team had access to proper PPE while also facilitating regular conversations with providers, staff, and infection control. Despite some very challenging moments, Callie remained composed and inspired the team to keep going. She is an exceptional leader and someone who lives our values of quality service, people, and teamwork every day. I'm honored to work with Callie, and I'm pleased to recognize her as the Outstanding Nurse Leader for 2020. She was nominated by Sarah Brown. Thank you, Callie. The Billings Clinic 2020 Friends of Nursing Alice Gordon Lifetime Achievement Award is presented to Danita Clarence. Danita is the Nurse Education Development Specialist from the Inpatient Pediatric Unit and was nominated by Melody Reinhardt. Danita is someone whom the staff and all know her and look up to and trust. She has earned this trust with her commitment to excellence. She always has a calm demeanor and demonstrates strong and fair leadership on the unit. She excels at teamwork, flexibility, listening, communication, customer focus, and interpersonal. She stepped into the manager role for inpatient pediatrics when the previous manager resigned and the new manager had not yet been hired. She performed both roles for several months and did both very well and with no complaints. This was a time of transition for inpatient pediatrics, and the staff members all felt grateful that she was able to lead them through this time smoothly. Danita has grown as a leader within Billings. She has moved from staff nurse to educator to interim manager, back to educator. Okay. Her leadership style is no nonsense but educational. She inspires nurses to be better, to learn, and to seek out knowledge for themselves. She is happy to supply knowledge and teach classes, but what she really wants is for nurses to understand where to go to find their own information. She empowers them to know their resources and reach out when they need help. Patients say she is funny and witty, but extremely knowledgeable. Her teaching mentality empowers parents to learn the care needed for their child. She meets parents on their level and readiness to learn. She provides them with numerous resources and wants them to feel comfortable when taking their child home. Danita works well as part of the team and seeks input from all disciplines to come to the best conclusion and decision for the child and the parent. She is constantly looking at new ways to provide education to staff and parents, even going outside of her comfort zone to do that. She has so much knowledge in almost every discipline of nursing, and she continues to grow and learn and work to expand her skills and knowledge as a nurse. And I have to say thank you for helping at St. John's Power Cottage as well. The level of trust that Danita has earned with the staff members of IPU and her coworkers throughout the year is truly exceptional. She has worked hard and diligently to earn the respect and trust of those around her. The success of the inpatient pediatric unit, training of the staff, and quality of care of our patients is always her priority, and she's always professional in her demeanor and her approach. She truly loves educating and lifting others to the next level. She is a member of the Education Council, the Research Council, and the Quality Council here at Billings Clinic, and she provides evidence-based education for the staff members and keeps them on their toes. She does impromptu mock code Broslos, held at any time, could happen any time, and there shares what she has learned with everyone. She assists other departments, such as the emergency department, and holds ENPC and TNCC courses for their staff. Everybody appreciates the care that Danita delivers. She is kind, compassionate, smart, and they know that she knows what she is doing. She never turns anyone down when they need help, and occasionally they just need someone to talk to. Thank you for everything, Danita. So the 2020 Outstanding Department Award is dethroning the emergency department. Goes to the inpatient medical unit. If you could all come down and join me down here with Lori for the photo op, that'd be great while I read this off. This was a nomination by Ronnie Restad. In March of 2020, it was first recognized that Billings Clinic would be getting an influx of COVID-19 positive patients. Inpatient Medical stepped forward and agreed to be primary non-critical care unit to care for these patients. Their commitment to provide the highest level of safe, evidence-based quality care was obvious from the beginning. Their willingness to mount the huge learning curve regarding care of this new patient cohort was evident in the research that they partook in with collaboration of their amazing leadership team. They helped create processes that were adopted by all of the other med-surg units. One of the staff nurses, Dylan Malloy, even worked with infection control to videotape appropriate donning and doffing of PPE videos that were shared organization-wide and are still used today. There are numerous firsts that this amazing unit took on in 2020. They were one of the first units to be involved with the biocoil decontamination of the N95 respirators to preserve PPE. They helped create a model that was followed throughout the organization. They were one of the first units to trial the Montana mask. They pushed their comfort zone and quickly learned how to provide safe care for patients with very precarious oxygen levels. The team learned quickly and truly provided world-class care for all but the very sickest COVID-19 positive patients. They did this with kindness and compassion. And during that time when visitors were not allowed, they sat with dying patients, held their hands, and cried. This team truly has heart. Throughout this year, inpatient medical struggled with and adapted to what often felt like the competing priorities of providing safe staffing ratios with staying within the budgeted productivity matrix. Staff and leadership worked with the VP and CEO to create more appropriate staffing ratios based on the acuity of the patients they were caring for. This type of change was a result of a very appropriate ARC call for help. This amazing unit could not have survived this past pandemic year without the fabulous teamwork that they displayed. They helped and supported each other even in the most dire of times. This unit continues to have the most robust partnership council of all the units in the division. The passion and commitment to excellence is evident in this incredibly engaged group. They have active participants in clinical practice council, quality council, reducing unit falls, pressure ulcer prevalence, safety liaison committee, and safe and reliable team, and have participated in several RCAs over the past year. These staff members provide valuable insight and feedback in each of these councils and truly represent the voice of the bedside caregiver. I don't think anyone on this team would have thought they could have pulled off the amazing feats that they did this past year. This is a humble unit that is led and supported by the amazing leadership team of Amanda Haycox, Lindsay Gustafson, and Kayla Lemire Phillips. Is that right? Lemire? I gotta say it again soon. Okay. They also have an incredibly engaged education development specialist, Amanda Hohalter, who assures they have the skills needed to provide safe care. They're always looking at all ways where they can even be better. I just can't say enough about this amazing unit. To quote the perhaps not so great philosopher Larry the Cable Guy, they get her done. But they do it with heart, humor, commitment to excellence, and true teamwork. Congratulations, Inpatient Medical. We're switching into 2021 now. Okay, keeping you in mind. Yeah, okay. So now we're going to switch into 2021. So our first Friends of Nursing Outstanding Nurse Award goes to Kayla Lemire Phillips. She's an RN from Inpatient Medical. I get your name wrong every time I try to say it. Kayla has demonstrated that she is a great leader by substituting for the clinical coordinator during her maternity leave. She then became the co-clinical coordinator of Inpatient Medical. She's very well respected by the nurses and the CNAs and is one of the most talented nurses we have on the unit. Kayla is an exceptional nurse because of her empathy towards our patients. She genuinely cares about people and raises the bar by her exceptional nursing skills. Kayla is known for her listening skills and empathy towards our patients, but she also practices these skills with our staff as well. The staff love how easy she is to talk to and enjoy her leadership. Kayla is without a doubt one of the most humble and knowledgeable nurses at Billings Clinic. She represents Billings Clinic with profound professionalism. She is the quintessential example of what a nurse should be. Patients love Kayla. They always remark about how she makes them feel. She makes them happy and laugh and feel better despite their problems. She helps heal people by uplifting their spirits. Thank you, Kayla. Friends of Nursing Outstanding Nurse Award for Ashley Nelson. Ashley is an RN from the cardiovascular unit and was nominated by Sarah Hockluck, Jen Tafelmeyer, Diane Hill, and Rhiannon and Abnett. Ashley is a highly engaged staff member on CVU. She stepped into the preceptor role for new nurses and nursing students on CVU and has done just a phenomenal job. She helps them gain confidence, follow the policies, and models kind and compassionate care. Ashley researched Pericare and Foley Care and brought an evidence-based product to our hospital that changed patient care for the better. She is able to speak to the CVU quality data and assist with hand hygiene audits. She also jumped at the opportunity to join the CVU wellness team that was formed based on data from our staff satisfaction survey. From the very beginning, Ashley was very engaged in CVU's Novice to Expert Staff Development Program. She progressed at a good pace and is now a TEAL or proficient nurse. She is an active member of the CVU's Partnership Council, and she brings new ideas to each meeting and challenges the members to think outside of the box for creative solutions for the unit. Patients know they are in good hands with Ashley. She is kind and compassionate and thorough. She will reach out to providers for any concern, and she engages patients in their own care and does a great job of making sure they understand their discharge instructions. Thank you, Ashley. Friends of Nursing Outstanding Nurse Award, Shannon Rosenberg. Shannon is also an RN from the cardiovascular unit. She was nominated by Sarah Hockluck and Diane Hill. Shannon is an experienced charge nurse on CVU. She is seen as a strong leader by the unit staff as well as by the house-wide staff. She frequently volunteers to be a super user for CVU. She is an active member of CVU's Partnership Council, and she brings a powerful voice to the table on behalf of patients and coworkers. Most recently, she has helped develop the unit-specific CPR roles. She is a regular educator at the CVU Skills Day and helps other staff learn practice any evidence-based initiatives. She is an expert nurse with superb assessment skills and is able to quickly and calmly act in urgent situations. She is cross-trained to the ICU and was a major player in the surge of the ICU patients to the CVU during COVID. She strongly led the team with optimism and provided phenomenal care to each and every patient. It is very common for her to take an ICU admit while in the charge role. Shannon promotes the growth of our new staff. Shannon precepts new charge nurses and goes out of her way to help newer nurses find answers to difficult questions. She has been PCCN certified for several years and makes that commitment to continual education. She's the go-to for all electronic systems and takes the time to get to know any new technology introduced on CVU. She is so thorough in her learning that she teaches coworkers about functions that most of us wouldn't know exist otherwise. She attended the Magnet Conference and brought back new ideas and products to help with infection control and safe patient transfers. Patients comment that Shannon really knows her stuff. They feel comfortable talking to her and they know any concerns. Families appreciate her kind and calm approach during conversations about unmet expectations. She does everything she can to meet the needs of the patients and staff. A true special star. Thank you, Shannon. Friend of Nursing, Outstanding Nurse Award, Judy Cervazzo. I feel like I butchered that one. Judy is an LPN from the endocrinology. She was nominated by Becky and Lisa. Judy is a great resource for our department in Billings Clinic. Even though she is designated to our weight management program, you can see her stepping up and helping throughout our whole department on a weekly basis. She steps up and takes on a leadership role as needed and is the go-to person for problems and solutions. She's an all-around great asset to Billings Clinic and to the endocrinology department. She has worked weekly at the vaccine clinic and helps us as needed whenever asked. She truly does go above and beyond her job duties daily. She takes pride in her work environment, the weight management patients, and everyone who walks through Billings Clinic doors. She is not afraid to bring up concerns about patient safety, and she truly cares about the patients who walk through and makes sure to take the time to listen when needed, brings humor to situations in times of uncertainty, and celebrates with them when appropriate. Judy is definitely a part of the glue that holds our department together. From stepping up and taking a leadership role when tough decisions need made, volunteering when help is needed, and the many great ideas she had brought forward within our department and organization. Her communication and work ethic are top of the class. There are not enough words in this dictionary to describe how appreciated, dependable, ambitious, and innovative she is. Thank you, Judy. Friends of Nursing Outstanding Nurse Award, Erica Wendland. Erica is an RN from the inpatient surgical unit, and she was nominated by Megan White. Erica contributes to all levels of the organization. She goes out of her way to make every patient comfortable. She is kind and caring to all of her fellow employees and patients. Every patient I receive from her waves goodbye to her with a smile, having had a good night. She does work the night shift. When I came to work, I know my patients have all been taken care of, and I felt safe and have felt safe and comfortable. That is saying a lot, since getting a comfortable night in the hospital is extremely hard. Not only does she help significantly with patient satisfaction, she sets every RN and CNA up for success who come in after the shift. She creates an effective system that enables progress and effective care given throughout the day. Erica is committed to quality, safety, and service. She spends extra time understanding everything about the patient, even if she is a charge nurse, with a whole patient load to take care of. She helps new RNs learn new skills, and she teaches them to verify their techniques with evidence-based resources. Her passion is seen every day as she works. She works as if there is jazz in her shoes, tapping up and down the halls, helping patient to patient. She contributes to magnet redesignation by being a luminescent leader in the nursing world. She is described as a kind, compassionate, easy to talk to, smart, confident, dependable, reliable, and relatable. She is confident and very present with everyone she meets. Her kindness creates an atmosphere for therapeutic healing in our patients and their families, and in the staff she works with. She deserves to be recognized. Thank you so much, Erica. Outstanding Nursing Support Staff for 2021, Colton Connor. From the Intensive Care Unit. Owing you, right? Colton is very passionate and always works extremely hard to ensure that his patients are not only safe, but are receiving the highest quality of care. Colton provides great care for his patients and is always willing to help out when needed. He does a wonderful job when trying to ensure patient safety. He is even part of our fall prevention team. He puts in the extra time in an attempt to come up with a plan to decrease the number of falls. He is always the CNA that notices very small changes with patients that are often very important changes. He is very aware of his environment as well as his patients' needs and concerns. Colton is involved in numerous committees and has stepped up to train new employees even when he was fairly new himself, or the conditions were not ideal to train a new employee. He has been told by numerous patients that he is very kind and compassionate, and they always receive excellent care when they are in his hands. Thank you so much, Colton. Outstanding nurse support staff, Amanda Ludwig. Amanda is a CNA from our inpatient medical unit. Amanda is one of our unit clerks. She is on our partnership council and offers such great wisdom, advice, and information. She is such a valuable force on our floor and helps guide us, RNs, CNAs, families, physicians, support staff, anybody that comes her way. She is our go-to when we need help, and she is always eager to help or find things out for us. She is very aware of who and what goes on the floor. She's the eyes on the floor, as RNs can't always see who and what is going on in patients' rooms. She fields phone calls and witnesses visitors and staff on the floor, and she has to be on her toes to ensure that all is safe. She tries to answer the call lights to see if there is anything she can do, or at least relay information to the RNs or CNAs, so at least patients feel their call light is being answered and not ignored. So she truly does help the patient feel informed, heard, and cared for. She helps get equipment, supplies, calls maintenance, and does all the things that are associated with the above and beyond. She is definitely a role model in regard to her work ethic. One of the first people visitors or staff see when they come to the Northside nurses desk. I know she doesn't get to mingle a lot with patients, but I admire her and feel that when she at least tries to see what the patient's needs are, when their call light is ringing, she is good about relaying and does have that smiling face for the patients to see. Thank you very much, Amanda, for all that you do. Outstanding Nursing Support Staff Award, Carrie Otis. Carrie is an MA from the Internal Medicine West End. She was nominated by Crystal Burr. Carrie helps with the onboarding of all nursing and support staff. She is knowledgeable in everyone's duties, so she is able to jump in and help at any time. She is part of the CPC Plus team to help keep West End up to date. She developed a binder with provider-specific information on the type of patients the provider sees and the procedures they do. Safety of all patients is her priority, whether it is a physical obstacle or a technical issue hindering care. Carrie jumps in to help all of her coworkers and any provider to make sure every patient is well taken care of. She offers to help any coworker regardless of which department they work in. She volunteered to work the VTU nearly every weekend this fall and winter. She is a role model and the mentor for all incoming MAs. She is one of 2 nursing staff that does the onboarding and training of all incoming nurses to inpatient medical and family medicine. I am an FM. She has been working toward furthering her education into nursing. Carrie is a kind and compassionate person. She will go to great lengths to make sure her patient is taken care of. Even patients of other providers know and love her. Thank you so much, Carrie. This year's Nurse Nominated Outstanding Physician Award goes to Dr. Colin Fisher. Dr. Fisher is a physician from the cardiovascular unit. They're claiming you forever. Dr. Fisher is caring, knowledgeable, and approaching family members and never seems rushed when he is in a room with a patient. He is collaborative and takes our thoughts and ideas into consideration whenever discussing a patient. He is approachable, even when on call for an entire weekend, and those days when it just seems like you have to call him frequently. He is personable, has a great sense of humor, and easy to work with, especially during critical situations. I know he will have our backs when he is on duty. He even helped one of the nurses scrape snow off of their car during a snowstorm. He is irreplaceable. Dr. Fisher is always willing to educate nurses, nursing students, CNAs, and any staff that has questions. He often has medical students shadowing him or residents, and he is always educating and challenging them to think critically about each patient. He is always kind and positive no matter how many hours he has been putting in. He has an excellent sense of humor. He never demeans the nursing staff. Dr. Fisher always tells patients to listen to the nurses when he finds out that they may be giving us a hard time about things. He sticks up for us and provides us with encouragement to get through the day. He frequently gives the nurse credit for the patient care while nursing is in attendance at the bedside. He makes people feel important. Dr. Fisher is always very knowledgeable about the most recent cardiac practices for the variety of patients he takes care for, and he explains his interventions to patients and the nursing staff so the nurses understand and so that the patients feel at ease knowing what is happening. He is very approachable and seems eager to hear the nurse's insight into the patient's plan of care. He takes the time to acknowledge and congratulate nurses when he finds out they have earned a certification or have completed research. Thank you for all that you do for nursing. You getting wet? 2021 Friends of Nursing Outstanding Leader Award, Amanda Haycox. Amanda is the nurse manager of the inpatient medical unit. She was nominated by Pat O'Connor, Nicole Berkey, and Kayla Lemire Phillips. Amanda is a magnificent leader. She was always there for our team. Without her support, we wouldn't have made it through COVID-19. She was always friendly and caring to her staff. She listens to our concerns and tries her best to help us any way she can. Amanda advocates for the floor and is also able to enforce policies and encourage staff in all of the changes that have taken place, especially over the last year. She has made us feel heard and checks on us on the floor. She helps to ensure that inpatient medical is always at our best, and if a problem arises, is always ready to help fix it. She has helped to improve our relationships with other units by talking with their manager or the clinical coordinator, finding ways to improve policies, and are helping to create new processes or policies. She is also a resource for other managers if they have a question or concern. She has a positive attitude and shows her commitment to her role, and is easy to say that she is definitely part of our team. She wants each and every one of our nursing staff to succeed. She truly cares about the staff and patients on the floor, and she gives us ample amount of time to complete education and makes plans with us if we face challenges to this. She treats both staff, patients, and visitors with respect and always acknowledges them in her 6-foot circle. Amanda chose to be a nurse to help people and make a difference in their lives, and that is exactly what she does. She makes a difference. Not only has she saved the lives of countless patients, she works tirelessly to make sure her staff are well cared for as well. She checks on us and makes sure we are taking care of ourselves. This past year has been difficult with morale, and she notices and tries to encourage and promote a healthy team. Amanda has contributed to Magnet recognition in countless ways. She encourages every nurse to strive for excellence. She keeps us encouraged and focused during the pandemic. Without her, we would have suffered great losses. Amanda makes sure we continue to improve and maintain our quality and policies on this floor. She enforces safe practice and advocates for staff to be involved and to voice concerns in situations. She is dedicated to being the best floor, and I believe because of her dedication, we truly are. She encourages us to participate in unit-specific quality measurements and is always asking for nursing staff opinions in ways to improve our care. Patients and staff adore Amanda because of her caring nature. She is the epitome of what a Billings Clinic manager should be and represents Billings Clinic with great professionalism and leadership. We are so incredibly lucky to have someone so dedicated to patients, staff, and this hospital. She is fair and takes her time to learn both sides of the story, and she couldn't be described as anything less than compassionate, hardworking, and dedicated. We are so lucky to have her on our team. Thank you so much, Amanda. Friends of Nursing, Alice Gordon Lifetime Achievement Award, Carla Hunt. Carla Hunt has an RN from CVU and was nominated by Diane Hill, Sarah Hocklet, and Rhiannon and Avnet. Carla is the epitome of what a great nurse is. She will do anything for her patients. She treats each one as though they are part of her family. She takes a special interest in them as a person and gets to know them very well. She will go out of her way to check on them the following day, even though she is not assigned to them, just to see how they are doing. She is kept up to date on all the practice changes with our patient populations, and she is often seen at any CVU educational opportunity, as well as hospital and community conferences. She challenges us to keep up to date on evidence-based patient care. Carla models for newer staff the need to seek out education and professional growth. She takes something from every class she attends, every skills day, and every patient she cares for. She is active in her church and frequently organizes fundraisers, meal trains, and more for her fellow churchgoers who are facing hardships. Patients absolutely love Carla. She truly listens to them and advocates for what they need. They know that she cares for them as individuals and not just another patient in a bed. She often receives cards and is mentioned in our patient satisfaction surveys. She is that saying, no one cares how much you know until they know how much you care. She builds that trust and then engages them in their care. Carla is such a positive person. She knows everyone on a first name basis, plus their spouses and kids' names. She is highly trusted by the provider team, and they know her assessment skills are spot on, and that if she makes a recommendation, it needs to be taken seriously. She is kind and engaging with everyone on the unit and anyone that visits the unit. By the way, Carla is possibly the best baker on CVU, if not the entire hospital. When she finds out that a patient's birthday or anniversary occurs during their stay, she will bake them a treat. She has adapted this habit to be COVID-friendly over the last year so that no one misses out. There was one year she baked a cake for every single coworker for their birthday for the entire year. Carla, what would we do without you? Thank you so much. I just found out Carla is 2 years away from 50 years in nursing. Incredible legacy too. The Outstanding Department Award for 2021 is going to the Viral Triage Unit. This nomination was by Bermandel. So almost a year ago today, as the first cases of COVID started presenting in our community, the providers from Express Care immediately responded to the needs of the community by willingly leaving their home departments to assist with setup of a viral testing unit. At this time, there was minimal knowledge about the disease and its spread. The Express Care staff used what information was available to rapidly develop a model to put ambulatory COVID triage and testing into place almost overnight. The teamwork that went into this was exemplary. From designing the space to obtaining the equipment and implementing protocols for testing and caring for the patients, this team did what most would take months to do, and it took them 18 hours. Some of the staff were pulled from their shift at Express Care midday to start contributing to the work being done. They courageously moved whoever asked without ever complaining because of their commitment to our vision and values, and most importantly, our patients. Over the course of the last year, the VTU staff made up of providers and nursing staff from Same Day Care and Express Care, as well as staff floating from many other areas within the organization. They've cared for over 20,000 patients. Approximately 18,000 COVID tests have been performed in this location alone. Over 11,000 patients utilized the triage system to obtain nurse visit only, and the COVID swabs were done without provider evaluation. In the beginning of the pandemic, there was great concern over PPE availability. The staff working in the VTU worked very hard to limit their use and get as much reuse out of PPE at hand, while still remaining committed to our patient safety. Throughout the last year, the Express Care team continuously pivoted to meet the needs of the community during the pandemic. As COVID numbers grew in August and the VTU was seeing upwards of 200 or more patients per day, the team recognized the need and desire from the community to implement a process to offer COVID swabs without full provider evaluation. Once again, within days of recognizing this need, the team worked together to develop a plan and protocol to safely triage patients. The space for VTU was expanded, and staff worked to respond to the different needs of the patients in two separate spaces as one united team. Providers working in nursing roles and MA staff continued to expand their skill set and performed at their maximum scope with a commitment to help the team with all tasks at hand. Many of the processes developed by these staff members have the opportunity to lead reformation of healthcare in our organization and our community. Methods for triaging of patients, safe social distancing, and isolating transmittable diseases have been shared throughout the organization and are helping us to incorporate safe practices as we move forward with normalizing the care. This courageous team has shown vast commitment to nursing excellence as they have put the needs of the patients far beyond their own. They have exemplified the meaning of teamwork with resiliency, courage, and positive attitudes while they have provided a great service to our community and our patients. The APPs and the MAs in this group worked with the resources that were provided and learned quickly when new tools became available. There were changes to current processes, and the providers sought out learning opportunities to ensure they remained up to date in the most recent evidence-based practice. One particular provider enrolled in an urgent care certification course to expand her knowledge base. The MAs acquired new skills as the work in the VTU evolved to meet the needs of the patients. They completed competencies to perform phlebotomy, EKGs, proper donning and doffing of different PPE, nasopharyngeal swabbing, and other new tasks. They learned how to work with new equipment as new point-of-care testing supplies came available. As COVID cases in our community have declined, the staff in the VTU continue to expand their knowledge and skill set on a daily basis, as work now focuses on safely incorporating care of potential viral patients into the expanded same-day care space. Thank you so much for everything you did over the past year. Your work is remarkable. Thank you. So can we get another hand for all of the winners from the awards for the last 2 years for Billings Clinic? Before the winners leave, we have your Friends of Nursing funds to be used for education as well up here, as well as your boxes for your awards. So don't leave without taking all of those. Thank you for joining us today. We appreciate you coming out and spending the afternoon with us at the ballpark. Thank you to our team members for participating as well. You guys, it's lovely to have everybody be part of this great day of excellence. So thank you very much. Have a wonderful day.